Afia Record is a deep tech healthcare company focused on data. Our business is the business of data and patient-driven and patient-centric healthcare. How do we do this? We build a platform to help hospitals collect, curate, manage, and create mobility of healthcare record. Ultimately, we want every patient to have the sovereign right of ownership of their health record and mobility of that data across the network and the ecosystem. And we've also built our B2C business, which is the My Record platform that allows the patient to go collect their own health record by themselves and curate that information, and is built on the blockchain driven by machine learning. And we are here to save the world.
So my name is Irene Kiwia. I am a co-founder at Afia Record. Afia Record is a health tech platform that is built on the blockchain and AI, truly built on blockchain and AI. We're not just saying that that's what it's built on. We built Afia Record in 2020 at the midst of COVID because the founder, John Kamara, lost a friend because of misdiagnosis. So our mission at Afia Record is to bridge the gap, between treatment, which happens when a patient walks into the hospital, and healthcare, which happens when a patient leaves the hospital. So what we are doing really is tracking the mobility of health data. So it's built around a patient. On a day-to-day basis, we move from one healthcare facility to the other. So very few times we would go to hospitals, but we do interact with healthcare as patients in multiple facets of our lives. We self-medicate at home, we buy things from the pharmacies, so all that journey. We wanted to build a platform that will capture the different meta data that a patient generates and allow for personalized healthcare. So problems, we've heard about all these problems today in terms of what the healthcare sector is challenged with. From scarcity of healthcare facilities, if we look at what's happening across Africa, to limited healthcare infrastructure, high cost of health systems, uninteroperable models of health systems, and portability of data. Right, so I won't talk about all these things, but I'll get straight into the product. So Afia Record has 4 products. So one is a universal patient portal, which is the first of its kind. We launched this 3 months ago, and the aim was how can we allow for patients to store, manage, access, and share at their own accord, the health information to whoever they want to share. The journey started with us building an electronic health management system, and when we built it, we went to different hospitals in Kenya, Nigeria, trying to onboard health facilities, but we were met by the same challenges. Legacy systems that were not interoperable, but companies and health facilities had invested so much money to build. So we ended up building a toolkit, from when a patient walks into a hospital facility to when a patient leaves that hospital. All those different toolkits, because we also saw that most of the legacy health platforms that exist don't necessarily have the entire user journey. So then, because the adoption was taking too long, we said, let's just create a universal patient portal so that patients can start the user journey. So wherever you start the journey, whether it's you today downloading My Record and starting to store your health information, or you visit a healthcare facility that has the platform, your information and your identification will be created, and you are always able to have access to your information. So in Kenya, during the peak of COVID, we piloted with the Mombasa County, which was the epicenter of COVID, and we were able to manage the movement of the disease, to track it, because, like I said, Afia Record is built to with metadata and geolocation. So the Mombasa County was able to see the different symptoms and geofence it and how all that was moving. So disease management, whether it's COVID or any other type of disease, and it's built in multiple layers. So from a hospital that has a chain in multiple provinces to a government that has provinces, that has wards, so it has all those different layers. But the important concept is that interoperability of health data around a patient. So patient portal is available today. We launched it 2 months ago, and we have over 55,000 users or members from across the world, so from 11 countries. And it's still very early days, but we're seeing a very quick adoption, especially in groups of people who have chronic illnesses and they have to walk around with their health information, or each time they visit a new facility, they have to redo their tests. At the moment, everything that a patient stores, they can decide to share it with whoever they want, so that sovereign right of health data is by the patient, which also is useful, especially if you look at the different regulation and policies across different countries when it comes to healthcare. And on the patient portal, you're able to also store information of your children, your family, whoever, depending on who else you want to add, and you can access telehealth. So with your information there, you're able to connect with other doctors on the system for second, third, fourth opinion, wherever they are in the world. There's a health resource center where we're bringing in different partners to put in verified information. It's not that there's not information out there, but the source of this information sometimes can be questionable. It has a symptom tracker and checker with all those things we heard today, reminders prompting you to take your medication, a follow-up to find out, whether that symptom is still there, and if it's not, what did you do? Did you take medication? Do you want to upload it? So it's built truly to follow the normal use case or patterns. Yeah, it has a mental wellness resource portal as well, where we're currently onboarding counselors so that we can create easy access to support. But at the baseline of it, again, that mobility of health record, it's not that there's not enough healthcare interventions, but most of them exist in silos. They're not talking to each other. You'll find a hospital, even a multi-chain hospital that has different systems that are not connected and talking to each other, and that then really truly limits, if we're to talk about deep tech and AI interventions and how it can support healthcare, data collection has to be centralized, decentralized, to allow for that type of innovation. For doctors, like we said, Afya Record can power one hospital, it can power a consultant healthcare provider, it can power a chain of hospital, a government or an organization that is focused on specific disease management, and it has different tools, so it can integrate with existing tools. Organizations are able to have different views of what's happening within their facilities. So for process management, but also for patient support, where you're able to connect and interact with your patients when they're not in your facilities. And we're continuing to innovating and build on this. Yeah, I don't have much time, but yes, so maybe let me focus. Yeah, the digital healthcare market on the continent is 1.8 billion, that's the estimate, so there's still a lot to be done. Those are the countries where Afya Record is currently present, but we're looking to partner with different organizations and different institutions so that we can scale our work. In terms of the protocols that it's built on. Like I said, we built it with AI modules, and it's built on the blockchain for security, for sovereignty of data, and also to ensure that the algorithm is able to run predictive and proactive analytics. And we do adhere to different security protocols. And at the moment, here in South Africa, we are talking to different partners to invite them to say this platform is live, is available, is very accessible and affordable, because we understand also how difficult it is to onboard new systems. So from patients to hospitals, local authorities, central government, NGOs, and companies and institutions that can roll out the platform within their employee networks, to insurance companies. We are open for partnerships. We currently, the numbers have gone up, but we currently have 50,000, not 26, this is an old presentation, users on the patient portal. We have onboarded over 200,000 patients, across 300 hospitals on the continent, and it's still very early days for us. These are some of the people we have partnered with. We recently partnered with GE Healthcare to power their diagnostic centers across Africa, because there was a huge gap where you go to a hospital, they send you for your diagnosis, then you have to go fetch it in person, so just that integration. But it will require a village collaboration for something this exciting to truly create the impact that it's intended for. Thank you.
Guys, this is an amazing piece of work. We wish you well. Let's give them a round of applause. Thank you.
Afia Record is a deep tech healthcare company focused on data. Our business is the business of data and patient-driven and patient-centric healthcare.